Okay, good afternoon, everyone. Thank you so much for joining us. My name is Debbie Elder. I'm one of the community liaisons for Aurora Behavioral Hospitals here in Arizona. We so appreciate you supporting us when we're doing the CEU webinars, and we really hope that you enjoy them, that you always find something beneficial. If you are a licensed person and you are interested in presenting, please reach out to me. We are always looking for great presenters. If you're passionate about a topic regarding related to mental health, please reach out. So I'll take just a minute here and introduce our business development team. I'll hand it over to Katie Rasmussen, who is our illustrious leader. She's our director here.
Thank you, Debbie. I like your intro better. So Katie Rasmussen with Aurora, and looking forward to the training. So
Awesome. Heather and Johnny, do you want to say hi? If not, I can. All right, so Heather is one of our community liaisons. Johnny is another community liaison, and Val Purdy is another liaison. So there are four of us liaisons, and then Katie as the director. You have probably met us in some capacity out in the community if you work here in Arizona. Today we are going to be hearing from Jacqueline Ojala and Jilzy Dens, who are with our outpatient team here at Aurora at our Glendale Hospital. They're both amazing. They keep outpatient running. Jacqueline is our director, and then Jilzy is one of our therapists. So they'll be joining us here. Yay,
Hi,
there they
everybody.
are.
Yeah,
Hi,
everybody.
thank you guys so
Right.
much. I'm going
We're
to
taking
stop
it
my
back.
sharing now. If anyone has questions or anything during, feel free to put that in the chat or the Q&A, and then I will stop you guys from time to time, or if you have a natural stopping point, feel free to just say, hey, are there any questions? So I'm going to hush now and quit sharing.
Okay. Hi, everybody. We're really glad to be here. Jilzy and I are going to work as a team today. And what we were hoping to do is talk about mindfulness and meditation with you guys today. And obviously with other clinicians, we always get a wide range of participants in CEUs, and we want to take that into consideration. And I think Jilzy and I are a great team to do that. We come from this topic from much different perspectives. And we're hoping to kind of share from those different perspectives. So we're going to be jumping back and forth during the CEU and, sharing those different things. So for those of you who maybe are just learning for the first time, hopefully we can give you the basics, and we're hoping for those of you that already, integrate meditation into your practice and, mindfulness as well. We're hoping we can at least give you a little bit of tidbits to, incorporate into your practice. So that's kind of what we're hoping for today. So I'm going to go ahead and work on sharing our presentation. So if you guys can be patient with me, I'm not the greatest with technology, so give me just a moment. Okay, and let me get this presentation going. Okay, can everybody see that? Debbie, can you see that?
Oh, yes.
Wonderful. I'm seeing the yeses in the chat there. Wonderful. So just so you guys know, I can see the chat there, and so can Jilzy. Debbie is going to be monitoring the chat for us, and hopefully there's going to be some natural stopping points. If you guys have questions, go ahead and put them there in the chat for us. And Debbie will try to stop us. We will have an official time frame at the very end that you guys can ask us some questions as well. So if she doesn't get a chance to stop during the presentation, we'll make sure we do at the end. So definitely do that. So we'll go ahead and get started. So just want to kind of start with an overview here of some of the things that we're going to be talking about. The first thing here is we're going to always start with the basics, especially for those that this might be the very first time that they're learning about mindfulness. So we're going to start with a definition of mindfulness and also how it can be used in therapy. How is it useful in the different types of areas that it can be used in? So we'll go over that. Jilzy is going to be talking about the different types of meditation, the different stages of meditation, and go into that into more depth. We're going to talk about myths of meditation. There are lots of those that go around, and we're going to delve into that a little bit together. We're going to go into very minimal on the research of the effectiveness of meditation. We're not numbers people as therapists, usually, at least Jilzy and I, that's not our forte, but we'll give a little bit on it. But we will talk about the benefits and, of course, from our own perspective and what we've seen with our clients, we'll give that perspective as well. And we'll always ask for your guys's, perspective. I'm seeing there's a large portion that's being blocked. There's something blocking the slides.
I'm not seeing it, so I'm wondering, is there something maybe on your computer that's blocking it?
I
see
do have
whole
the
thing.
chat up. I just clicked out of the chat. Is that making it better? I don't have the chat up.
I see
So
the whole thing.
okay. So the next part that we'll go into is how can we incorporate these concepts into traditional therapy settings, right? So that sometimes can be, I think, difficult, especially for newer clinicians. We have our traditional models of therapy, and how can I incorporate these in? So we'll give some ideas of how you can do that. And then for Jilzy, we have the great opportunity of having her. She will share some of her background that she has. And she has additional training outside of her psychotherapy training that she can bring into practice. And so we'll share some innovative meditation practices that she can share with you guys. And then I think one of the biggest things that we encounter as therapists are barriers, right? Client resistance to meditation, maybe clients who are uncomfortable with meditation. So we'll be talking about some of those barriers and how we can help our clients through those barriers together. The last thing we'll talk about is the potential dark side of meditation. So are there any contraindications to using meditation with therapy? And we'll review those together. Before we move on to the rest, Jilzy and I thought it would be really nice if we all got together and did a meditation together, just to kind of ground ourselves in this CEU together and get ourselves in our bodies. And so if you guys would, open your minds and your hearts and do that with us, you can join us. So please try to, relax in your chair and find a comfortable position. And we're going to be doing a body scan meditation today. And so I'm going to be doing that guided with you guys today. And so I'm going to give you guys a few seconds to go ahead and get comfortable. And we're going to do that body scan today. So the purpose of a body scan meditation is to relax, pay attention to how your body feels, what it might be telling you. Listen to your body and be in your body as fully as possible. Sit with your back stiff, your back straight but not stiff, with both feet on the floor, with your hands comfortably in your lap. If it's comfortable for you, close your eyes. Listen to the sound of my voice and follow my instructions. Try to stay awake and alert. Remember to breathe completely and let the breath flow freely into and out of your body. When you notice your mind wandering, gently bring your focus back to the sound of my voice and the instructions. Now direct your awareness to your belly as it rises and falls with each breath. Breathe freely and naturally, finding your own rhythm. Feel your body become heavy as it sinks deeper into the mat or your chair on each exhale. On the next inhale, direct your attention all the way down your body to the soles of your feet. Become aware of your toes, the arches of your feet, the place where your feet meet the floor. Notice any feelings in your feet, any warmness or coolness, pressure, tingling, or tightness. Direct your breath to your feet. Imagine that you can breathe deeply directly into your feet. On your next exhale, imagine your breath traveling through your right foot, shooting from the bottom and taking with it any tiredness or tension. On your next exhale, send the breath through your left foot, taking with it any tiredness or tension as it exits. Now focus your attention on your legs. Notice any feelings in your legs, being aware of your skin, your bones, and your muscles. Perhaps your legs feel warm or cool. Now notice the contact of your legs with the chair, allowing your attention to explore any feelings in this part of your body. On the next inhale, direct your breath all the way down your entire left leg, and now breathe down your entire right leg. Now direct the breath down both your legs, breathing in relaxation and breathing out any tiredness and tension. Whenever you find your mind wandering, let go of the thoughts as gently as you can and come back to focus your attention once again on your body. Now focus your attention on your lower back, observing any feelings in this part of the body. Maybe you can feel tightness, tingling, aching. Allow your attention to move slowly up your back and all the way up your spine. Bring your awareness to where your back touches the chair. On the next breath, breathe into the entire back area, allowing the muscles to relax and release tension with each exhale. Let go of any tiredness or fatigue, breathing in openness into your entire back. Shift your attention to your belly. Feel your abdomen as it moves up and down, rising and falling with each breath. Take a deep breath in, filling up with the belly, allowing the abdomen to fully expand on the in-breath. On your exhale, notice the feeling of the breath leaving your abdomen. Now move your attention up your chest. Draw your awareness to the movement of the chest with each breath. Perhaps you're aware of your heart beating. As you breathe into the chest and abdomen, draw in renewed energy. And as you exhale, let go of any tiredness or tension. Now draw attention to your arms and hands. Let your attention rest on your fingertips of both hands, focusing your awareness on sensations of tingling, the feeling of air touching the fingertips. Maybe you feel moisture or dryness. Aware of the sides of the fingers, the knuckles, the palms of the hands, the tops of the hands. Now pull your attention up your arms and allow it to settle on your shoulders. Notice the muscles here. Really focus on any sensations in the shoulders. Maybe the shoulders feel tight or tense. Maybe they feel heavy or light. Breathe deeply into the shoulders, releasing any worries or concerns, and allow your shoulders to completely soften. Now draw your attention to your head. Notice any feelings at the top of your head, your forehead, your eyes, your nose, your cheeks and mouth, your jaw, your neck. Bring your awareness to rest on any feelings in this area of your face and head. On the next inhale, feel this part of your body, breathing in positive energy and relaxing it completely. Breathe out any tightness, any tension, and any tiredness. Now expanding your awareness, feel your breath move easily through your entire body as you rest here, noticing the movement of the breath from your head to toes. Notice how the breath moves freely and easily from your feet to the top of your head. As we conclude this activity, be fully aware of your body, whole, complete, strong, and at ease. I encourage you guys to sit with your body, taking a few last breaths, be one with your body. And as you feel comfortable, go ahead and wiggle your toes, wiggle your fingers, open your eyes. And whenever you're ready, go ahead and bring your awareness back to the room. And maybe think about how you feel, if it's different than how you felt before you did the meditation. And join us back. All right. Boy, is it hard not to see you guys while we're doing the presentation. You know, as clinicians, I'm used to seeing the people I'm with, so that's kind of rough. But I hope you guys enjoyed the meditation. I know I really love a body scan meditation. I can't tell you how many times when I'm doing one, I don't realize how tense I am in certain areas.
Yeah,
How about you,
that's true.
Josie? I saw you doing it.
Yeah, that's true. When you tell about it, then I feel, oh, my shoulders are tight. Okay, let me loosen it.
Mhm.
Like that part by turn, when you go through it, okay, I'm loosening it.
Mhm.
Yeah.
Yeah,
Yeah.
it's amazing how we can go through our day and not be aware.
That's true. We are holding it
Mhm.
all day.
Yeah, the whole day and how good we feel afterward.
Mm.
And you know, when we do a meditation ourselves or when we do it with someone else, I think another really important part of it is reflecting back afterward on that, right? And how was that for me? Did I learn anything from it? Is there something I can take forward into my day? You know, knowing that I was carrying that tension in my shoulders or a different part of my body and
Yeah,
attempting to be aware of that throughout my day.
that's true.
So if you guys can take any of those insights from your meditation back into the rest of your day, that would be wonderful. All right. Awesome. Okay, we're going to go ahead and move on in our presentation then. So I'm going to go to the next slide. I think. There we go. All right, wonderful. Hopefully no major technical difficulties as we go along. All right, so again, for some of you guys, this might be, you know, complete repetition. Hang with me if it is. So we're going to start by going into the basics of mindfulness. So first, we're going to start with the basic definition of what is mindfulness. So just starting with the basics. And, you know, what I'd love for you guys is I love that participation. Again, I can't see you guys in the chat, which is a bummer. But this is a direct definition of what mindfulness is. Mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So that's obviously a definition of it, but I'm wondering from you guys, what comes to mind when you think of mindfulness? Do you mind putting that in the chat for me? What comes to mind for you guys? We have lots of good things: centered, staying present. Ooh, pausing, that's a good one. Less overthinking, peace. Yeah, deep relaxation.
Okay, Jacqueline, I think they all know it.
Yeah. Yeah, hopefully we can teach you guys something. I'm not quite sure. Wonderful, right? Not being in a hurry.
Are in it. Okay,
Yeah.
let me go.
Who knows if we can teach you anything? Stop moving for 5 minutes. That's awesome, Debbie. Yeah. Being present in the now, right? A large point of it is being present, right? And that is so hard for most of us. So that mindfulness, that awareness. Ooh, awareness right after that, right? Okay. The black box is back. I think it might happen when I open the chat box. Yeah. So I'm trying to close it, but I love to see you guys, what you guys are putting in the chat. So I'll move it again, but thank you guys so much for participating in that, because I like that, right? Because the definition is one thing, but we all have these, you know, direct ideas of what it means to us, and you're all right. Absolutely. Okay, awesome. For me, mindfulness has become, and I think obviously for you guys, it's become so important to our work with our clients. I think I'm trying to think back before, it became so popular with DBT and all these other things. And I don't know what I did before I became so aware of mindfulness, and because it's so central to what clients need to know. So we're going to talk about some of the benefits of teaching our clients mindfulness in therapy and helping them become more aware. So we'll talk about some of those things. So like you guys said, one of the main words that kept coming up in the chat was awareness, right? So it gives our clients an increased awareness of feelings and sensations in their body. So one thing we notice with our clients quite frequently is they have a hard time identifying how they are actually feeling, right? So not just how they're feeling, but also they have a hard time identifying their symptoms. I am Most of my experience has been with substance abuse clients, and I often find that they have a hard time identifying their post-acute withdrawal symptoms, how they're, and even with mental health clients, how are their mental health symptoms affecting their body, right? So when we do that body scan meditation, we're becoming aware of what's going on with our body. And oftentimes our clients become so used to denying their feelings and denying anything that's unpleasant that they lack the ability to have that awareness of their body sensations and their feelings. So teaching them mindfulness can help them get more in touch with that again. We can teach them to practice labeling non-judgmentally feelings and sensations to be able to communicate to themselves or others. For me, it's become a huge part of my practice with clients to begin teaching emotional intelligence as a baseline for my clients, and mindfulness helps me do that. So they can get that awareness of how they're feeling and then put a label on it and not label certain things, certain feelings as good or bad, right? So a lot of us have grown up that way or been taught that way, that certain feelings are bad or certain sensations are bad, such as pain, and things like that. And then it affects us. And so mindfulness changes that, because a huge part of it is paying attention non-judgmentally. So I find that that is really helpful in our therapy when we're trying to change negative thinking and also emotion regulation. Increased acceptance and normalizing of a wide range of emotions, bodily sensations that are ignored or labeled as bad. So again, when we're teaching, emotional intelligence, we want to teach clients that it's important to feel a wide range of emotions, that they're natural, that they're normal, that they fit lots of normal things that happen in our days and in our lives. And I find that mindfulness helps us normalize that for clients. The more they feel those natural emotions throughout their regular day, when they have crisis, they're more used to those feelings. And I find that that's really helpful to teach them in therapy. And I, put this, that one thing that I'd like to, continue to encourage all of us in our field is not to skip this really, really important step in therapy with our clients. So I think, over the years, there's been such an emphasis on teaching clients coping mechanisms, right? Which are so important, right? We obviously, our clients need to learn coping skills. They need to have that toolbox. But I'm sure most of you guys would agree and have found this as well, that if I teach a client coping mechanisms, they unfortunately aren't going to be able to use those coping mechanisms if they don't know how they feel to begin with. So if they're not mindful, if they can't identify how they feel, or they're not aware of what's happening in their body, they're not going to be able to pick the right coping skill that's going to fit or help. And so I find that they're not going to be able to utilize the right coping skill to help them. So I think we need to teach mindfulness first and then coping skills second. So I think this is a step that we often skip. So really, really important in therapy, actually. So I think most of us are probably pretty familiar with this quote at this point. You can't stop the waves, but you can learn to surf. And, I think we're doing our clients a huge service if we can teach them this, right? And mindfulness helps us to teach our clients this. In life, they're going to encounter so many things, so many challenges, so many difficult emotions, pain in their body, discomfort, right? As humans, we are uncomfortable a lot, yet we don't teach one another how to be uncomfortable and how to feel uncomfortable, or normalize that. But mindfulness does that, right? So we can't stop the waves, but we can teach each other how to surf, right? So mindfulness teaches us that, how to notice, how to ride the wave. So I thought I'd throw that in there because we're all pretty familiar, and I think it really helps as a reminder of what we should be teaching our clients. So that's one of my favorite quotes. So I thought I'd share that with everybody. All right, I'm gonna move on. Oh, my little animation I threw in there.
That's cute.
That's cute. Oh my goodness. That's me trying to do PowerPoint after 100 years. Okay, I'm gonna go ahead and turn over to Jilcy, so she can talk to you guys about different types of meditations.
Okay. Hello, everybody. I'm Jilcy.
And you're gonna have to be loud
Oh,
for
yeah.
once.
Of course, I need to, right? Okay. So yesterday I was thinking about what to talk to you guys about meditation. I was doing groups every day and there was not much time to Google it, find facts like that. And Jacqueline was preparing the PowerPoints. Thank you, Jacqueline.
You're welcome.
Yeah. And so I thought, okay, if I can Google the facts, then you can also Google, right? So there is not much point in, Googling and bringing stuff to you guys. So I was thinking, what meditation I do with my clients, or, what I would studied in India about meditation. So that I can share with you guys more than the theoretical part of the meditation. Okay, so yoga, pranayama, and meditation, that are the three things that goes together. Yoga, we know that it is the stretching, the slow movements it is. And pranayama means, prana means life and yama means control. So it is like controlling the breath. So that is the pranayama. And then the meditation, of course. So, when I talk about when I studied in India like that.
Well, first of all, Jilzy, would you like to share with them a little bit about your background? I think that would help them understand the perspective that you're coming from.
Yeah, sure.
Yes,
sure.
please.
Yeah. So I did my bachelor's in Ayurveda medicine. Ayurveda medicine, it is a mainstream medicine in India. Before the Western medicine came to there, it was Ayurveda medicine we used there for treating all of the diseases like that, whether surgery or anything like that it is. And Ayurveda medicine is based on herbs particularly. Yeah. And it came from as a part of the Hindu religion. Why it is always connected with religion? Because people will be so interested, or it feels like an obligation to follow it when it is connected with religion. So that's why yoga and meditation are also connected with religion. It is, yeah. But when we look into the history of the meditation, we can see that not only in Hinduism, even in Buddhism. So it came up from Buddhism, Hinduism, and we can see even in Christianity, Sufism. I was talking to Sahar about it, and she said in Sufism, there is meditation.
Yes.
Yeah. And
very
then,
old history.
Yeah, the Sufism, Jewish, like that connections are there about meditation. And in Hinduism, particularly the sages, they meditate in Himalayas, the Himalayas mountains. And the interesting fact is that Yeah, just checking the.
You're doing good.
Yes, yeah. Okay, the interesting fact is that when they meditate in the mountains, like for a long time in an intense way, they even can't sense the cold weather there, the snow falling there, because they won't be like layers like us. They will be with minimum dress, wearing it, and they will be in like the mountain dens there. They will be doing it. But when they evoke or enlighten their internal energy, like the Kundalini, it is said. Kundalini, then the fire is inside them, which keep them warm. That interesting it is, that
Yes.
amazing it is.
Very
Yeah.
amazing.
Yeah. So like that, when it comes to meditation, the practice, we do like that. No, it is less intense because we are not completely dedicated our life for yoga, meditation like that. So like lighter versions of meditation came into being,
Yes.
where the normal people can also practice it and get the benefits of it.
Right.
Like that. Even though we don't awaken our Kundalini, or still we wear the layers of dress and we won't
Yeah.
fly over, like still we can get the benefits
Right.
of it. Yeah. So talking about it, there are a lot of types of meditations, and there is nothing like right or wrong in meditation. Like whatever comfortable for you, suits for you, that's your type of meditation. And we need to customize it. It's not like a one size fit for all.
Right.
Because for some people having like a lot of anxiety like that, if you tell them, okay, sit for 20 minutes, meditate, it won't happen, right?
Right.
They
And-
can't focus.
Yeah, and we're gonna go over that when we get to the myths, right?
The myths,
Yeah,
right?
absolutely.
Yeah. Yes. Yeah.
Yeah.
So like that, there are different types of meditation came into being, like evolving from the most intense ones,
Yeah.
like
From
that.
the intense
Yes,
monks in
yes.
Hinduism
Simplifying
down.
it down like that. And the most popular is the mindfulness meditation. As we said about mindfulness now, it is like non-judgmentally, being aware of it, validate what you are going through. That's the most important thing. We are not going to solve anything during our meditation. We are just understanding and validating what is happening with me, what I am feeling it now. Am I anxious? Am I depressed or frustrated? Just thinking through it, validating. That is the mindfulness one. And that is the most easy or simplest one. Without a trained teacher, you can learn it.
Yeah.
Less complicated one.
Yes.
It is the mindfulness.
Easiest one.
Easiest one.
Yeah.
So either watching on YouTube or no, you can learn it easily.
Yeah. Guided or unguided, right?
Unguided is fine. We can learn it. Yeah. Then another one is the progressive relaxation or body scan, which we did it. An awesome job here. Yeah. Okay. So that's a progressive body scan it is. In progressive muscle relaxation, that will help to keep us in focus. Like we are now contracting our muscles and relaxing it. Either we can do as a group of muscles or like a particular area, like contract the calf muscles, relax it like that, or we can do the whole body.
Yeah, so it can also sharpen the mind, right? Because there's more intensive muscle relaxation meditations and some that are easier, right?
Easier.
So we kind of did an easy one, right? So it's like bigger areas and stuff. But there are some that make you get very particular areas of the body, right? And it's sort of mindfulness, right? Because you have to really focus your mind, right? And it can be difficult to do. So it's a practice, right?
By practice.
Concentration.
Yep. And then making it tense and releasing it.
Yeah.
So when we make it tense and release it, there's a sudden flow of blood also.
Yes.
The circulation increase. That again, we all the distractions, it is easy to focus again.
Yeah.
Moving out from the distractions.
Yeah.
Like that.
So you can't be focusing on the things you're anxious about, right? Because the brain can only focus on one thing at a time, right?
Yeah.
So I have found that to be helpful for my clients who have racing thoughts, right? The ones who struggle with mindfulness meditation, and really have a hard time with guided meditations. The body scan meditations actually are really good for them because it's not thought based.
Yes. They can just physically focus.
Focus.
That's the thing. Yeah.
Yeah. So those are really good for those clients.
For them. Yeah. Okay. And then comes the visualization. That's my favorite one. I can go to Hawaii, without paying the flight ticket.
Yeah.
Being in the Hawaii beach, right? Okay. Sitting there and meditating like that. Visualization makes it effective when we get into the details of it,
Uh-huh.
the minute details of it.
Yeah.
Like sitting in a beach, okay, relax and meditate. Okay, no.
Yeah.
Feeling the warmth of the, the cool air there, and feeling the sand, and that all the senses come together, then the visualization meditation becomes the most effective it is, and most relaxing also.
Yeah.
Again, when at the same, like we are taking our focus to the things around there, a completely different scenario from where you are here, visualizing it and meditating. It's more effective then.
The other thing too, I've noticed with my clients with the visualization, I really like is it can definitely change mood, right? Because our memories are so tied to feelings,
Yes.
right?
Yeah.
So we can invoke certain feelings based on memory.
Yes.
So what I've done with certain clients, and you guys can do this too, is if you have clients who have like really positive memories of like going to the mountains at a cabin with their family during the holidays or something like that, and they've been feeling kind of down or depressed, you can do a cabin visualization, right? And they're visualizing they're like cozy by the fire with their family.
Yeah.
Our brains work that way, right?
Yes,
And if we invoke that visualization, we can feel it and our brain will feel happy.
Yes. Yeah.
Right. And it's
Yes,
amazing how
yeah.
the brain works that
That's true. We are telling back our brain to be happy.
way.
Brain is sad. Okay, we are telling brain, okay, you have to be
You're
happy.
happy because you
happy.
remember that, right? It's just like how we, smell a certain scent, right? And it brings us back to that time where we felt happy because
That's
we were
true.
there and it works.
Yeah,
So it's
that's
nice.
true.
And so it's good to teach our clients that they have that at their disposal.
Yeah.
Yeah.
The memories, bringing it back,
Mhm.
or wherever. If they haven't been to that beautiful place, but they want to,
They can
they
imagine
can
it.
reach there.
Yeah.
They can imagine, visualize it, and do
Yeah.
it. Yes, yeah. And then today, in the group now, today morning, the meditation I was making the clients do it, and after that, I asked them, okay, what type of meditation you usually do? Like every day we are doing meditation in the group. So what type you do like that? Then one of my client was saying that he was doing like chanting meditation, the mantra meditation.
Wonderful.
Yeah, that is interesting for me. Then I asked him what type of mantra it is. Like he said it is Namyaho Rangado, like that. It's a Buddhist one.
Wonderful.
Yeah, Buddhist mantra it is. So he will hear that and he will tell along with it.
Wonderful.
And then I asked him, how you feel after that? Then he said, when he do it, he is chanting it, that mantra, and he is giving it to the universe. And that positive vibes is coming back to him.
Wow.
I was amazed by the insight he's having with it.
Yes.
How involved he is in that mantra meditation,
Yes.
getting that benefits like that. That's the part of mantra meditation. When we chant it, we are, getting that vibrations of that mantra in our body, the mind and the soul like that. So we are fully focused. So if somebody is struggling to focus, mantra meditation is a good one.
Yeah.
Yes.
And I find that, when we talk about barriers, right, and we can talk about that now, we find that some clients who are uncomfortable with Eastern, things like that client obviously is not uncomfortable. And that's so
true.
wonderful, right? We want to encourage our clients to open their minds, open their hearts to new ideas.
That's true.
But we have some clients who are so uncomfortable. And so do they have to do a Buddhist mantra? Absolutely not,
No,
right?
no.
Can they say, I throw loving kindness to the universe?
Yeah.
It can be
Yeah.
anything, right?
Anything.
And they could repeat one word over and over again. Love,
That's true.
peace,
Yes,
anything could be a mantra, right?
Yeah, anything can be. But only thing when you talked about that, there is a little scientific reason why the mantras are repeated.
Okay, thank you.
Yeah, so that one is that it's the syllables are arranged in a particular frequency.
Oh, wonderful.
So when it is coming together and when they repeat that particular frequency, it gives a separate energy.
Okay.
So, for example, there is one called Gayatri mantra.
Okay.
It is a very powerful mantra. We cannot chant it even sitting here. Like it should be underwater.
Wow.
So the sages, they go underwater, like, half filled or under immersed in water and chant it.
Wow.
Otherwise, it is very energetic, like fire will, come up like that.
Wow.
Yeah, I haven't seen but heard about it.
But
Okay.
because there's certain frequencies.
The frequencies.
Wow.
You have heard about some of you have heard about 528 hertz frequency
Right.
one. Healing one it is.
Absolutely.
Yes.
Yeah.
If you hear a music with that 528 hertz frequency, we feel it.
Yes.
That vibration will come to
We
us
like
and we
that.
feel that.
Yeah.
Yeah. So that's why this mantra meditation becomes significant.
Significant.
Because of that arranging of that syllables.
And so what you're saying is, if I hear you right, Josie, is that
Mm.
certain mantras are maybe more beneficial
More beneficial.
because they're actually arranged specifically for certain
Yes.
frequencies.
Frequencies. And we need
Wonderful.
to be careful about
Be
also.
careful with the
Cautious
frequency.
also. Yes.
Okay.
Yeah.
That I did not know.
Yeah. So that's why I
Yeah.
said mindfulness we can learn from even YouTube videos. But when it comes to mantra meditation, there should be a trained person
I
to
gotcha.
tell you about it.
Be careful.
Yes. There is another one called transcendental meditation.
Yes.
That is becoming popular now.
Yes.
In that, the difference is that in transcendental, the trained person will tell you, okay, this is the mantra or this is the words you need to enchant. So it is like customized.
Correct.
For that particular person, for anxiety or depression, what he's going through, it is customized for them.
Gotcha.
That's the transcendental. Mantra, it is like, it is general, like words, the mantra, like enchanting.
Okay.
Okay, yeah.
Yeah, that's helpful.
Yes, and then coming to the movement one. We know that, yoga, everybody, familiar with it. Yoga, we can do it. But not just yoga. Even if it is as like gardening or Tai Chi or nature walks, we can inculcate the meditation with it. That's the walking meditation.
Yes.
When we go for a walk, like hiking or like that, we can do the walking meditation where all our five senses are aware of what's going on. Like that. Getting the smell of the flowers, hearing the birds chirping, right?
Yeah.
All the senses are involved in it. But only thing is that it should be an easy walk. When you are climbing the rocks, you can't do the walking meditation.
Because all you're thinking about is, ow, my body hurts. Like,
am I going to fall down or not? Like
your
that.
fears.
Yeah.
Like, if those things are interrupting your ability to engage in the nature and things like that, then it can interrupt the.
That's true. So it should be an easy walk.
Okay.
Where you can meditate along with it. Yeah.
Okay.
Hope everybody is following. I can see everybody.
I know we can't see everyone.
We are talking here, having a nice chat.
This is amazing. We just had one question. What meditation can work for clients who can't imagine? So example, people with ADHD or extreme trauma where they can't focus.
Very good. Those are good
Yes,
questions.
yeah. In that, the movement meditation is the best one. Because ADHD, they always want, it's a little restless, right? They want, they divert their focus easily. So movement meditation, you can combine with anything like yoga or walking meditation or doing some artwork and doing the meditation. They can paint and meditate. I have a client in my group, always she will paint during the meditation. And she said it helps her to focus on meditation.
Yeah, in extreme cases, I always encourage my clients to, so we do group therapy, mostly group psychotherapy. And so we incorporate meditation into there, and we always expose our clients to different types of meditations almost every day in order for them to find what works for them. And I always encourage my clients to try every type of meditation and to really attempt every time. But even you'd be surprised, those clients with those limitations, even ADHD, I find that are mostly able to do all the types of meditations, but maybe with some modification. And so I find that some of them you can do with modification. For instance, like you mentioned trauma. I have a lot of clients with trauma who we'll get to that more in depth, just so you know, for the person who asked the question, when we get to barriers, like how can we help clients through barriers? But that can't close their eyes, right? So they don't want to close their eyes because they're fearful of not seeing what's going on around them, right? Or they want to watch the door, right? Things like that. And so what we'll teach them is to keep eyes open and have a fixed, soft gaze. right, instead during the meditation. And that works completely fine. And then they can still participate fully in the type of meditation that we're doing. In the visualization meditations, we might just have to modify the type of visualization we're doing to avoid their triggers, right? And things like that. And for ADHD, when we get into some myths about meditation, I would say that I would allow them to be restless, right? And still participate in the meditation. So we'll get to that, but most meditation you can be restless and still participate in. So, if they're moving around like this and they can't keep their feet fully still, or they need to stand up and do the meditation, things like that, I would modify for.
Yeah.
I hope that helps answer the question. I don't see anything in the chat, so I'm hoping so. Okay. But we'll have the Q&A at the end too. So if we didn't answer the question, we'll get into
We'll
it
come
more
into
too.
it. Yes.
Yeah.
Yeah. And then some other type of meditations I would like to mention, the spiritual meditation.
Oh,
Spiritual meditation, in that meditation, the difference is that and so they will be, concentrating on there and the universal power like that. So it is like reunifying with my soul to the universal soul like that with the higher power.
Yeah.
Like that meditation is the spiritual meditation. It is. So we call it Jivanu and Paramanu. Jivanu means the soul, part of the soul in me. And Paramanu means the universal soul or the higher power it is.
Okay.
So in meditation, it is like a in-depth meditation where the person will try to connect with the Jivanu and Paramanu.
Okay.
It is.
So like build a connection between
within
the two.
the higher power. That
Okay.
is the spiritual meditation.
Awesome.
It is. Yeah.
Perfect. And Jilcy, is prayer considered meditation at times?
Yeah, for the religious meditation, the prayer also can be considered, particularly with the hymns and the songs and everything, right? When they do it, it is the religious meditation.
Okay.
Yes.
Because it's a sense of connecting to God when you're
connecting
doing
to God,
that.
whichever particular God they want to connect, they can connect with it.
Okay.
Yeah. Yes, like that it is.
I know that sometimes that's
Yeah,
considered.
do it like that, right? Yeah. And then another one, the most recent, it is the Smriti meditation. It is, and it is one in the Ayurveda psychotherapy. It is a Smriti meditation. Smriti meditation, when I went through it, I felt like it is more with the trauma therapy. So,
and you're going to get into that more in depth in your other slides.
We can go it later, or we need to cover now.
No, you have it on another slide.
Yes, slide. So we will go to it.
We'll get into that one in a little bit more depth because it's one that is being incorporated into therapy more.
Newly into it, the new trend. Yeah.
The new trend we'll kind of tell you guys about. Jilsy's been looking into that.
Yes. I go to the next slide. Yeah.
Hopefully, there it goes. All right. Oh, I do it like that. There we go. Cool. Bear with us, guys.
So we were talking about the meditation, and the stage 1, it is the preparation. We know that if you are engaged, busy like that, lot of things going on like that, when we come and sit for meditation, we have to ground ourselves, right? That won't be easy, to cut all the thoughts and start meditation. No, it won't happen, right? So the one is that we need to prepare ourselves. That's the using the grounding techniques like breathing, or visualizing. Everything will come into it,
and like even clearing a space, right? Like
comfortably.
Find a quiet space, like all that preparation, right?
Some people will do like they will put some aromatic oils or salt lamps, to get that ambience, to get into that meditation. That preparation phase is very important. Otherwise, the whole 10 minutes, the mind will be wandering around like that.
And logistics wise, right? And when we're talking about incorporating meditation into therapy, is thinking as a clinician how we can prepare our environment for therapy, right? And so just logistics logistics-wise, like for instance, here at Aurora, we have a sign that we put outside of the door, right? Just making sure that clients who show up late aren't knocking on the door,
Yeah,
right?
that's
Interrupting
true.
people.
Yeah.
We make sure the lights are turned off so that
Yes.
it's a calmer environment. For those that have trauma, we do have natural sunlight that still comes in, so it's not fully dark, you know.
That's true.
But yeah, just clearing that space, being mindful of the
Yes.
environment so that
Yeah.
we're prepared to start.
Preparing it.
Right.
So we are telling our brain, okay, I am going to relax.
Yeah.
I am going
I'm
to
about to.
like that.
Yeah.
Giving some, signs.
Exactly.
Yeah. The second one is relaxation. Then once we are prepared, for the meditation, we get into the relaxation. Relaxation we can do either with some deep breaths, or like, visualization, like, okay, I'm going to take a walk through the forest. Yeah, the green trees are around, like visualize, and then slowly we can relax into that state where we are ready to meditate. Again, during relaxation also, the thoughts will be flowing through you. But there is nothing called stopping the thoughts. Let it flow through you. That's a thing. Let it flow through you, and then your focus will slowly come back to the breathing. That's how the relaxation phase goes.
Awesome.
Observation. And during the observation, as I said, the thoughts are flowing. So you will be observing that, okay, I am a little anxious today than yesterday, or the traffic was making me, nervous, or I had a, rough morning. I had an argument with my wife. Like that, lot of things will be there. So you are just observing like a person out of you observing you, like, that objectivity you are getting through that, in that observation phase. Yeah.
Yeah.
Reflection. This is getting a little more deep now. Okay, so preparation is done, relaxation is done, and observation is done. In the reflection phase, as I said, meditation, it is, mindfulness is there, but the basic or the most important is meditation is listening to yourself. That's it. Listening to your inner self. That is meditation. So in the reflection phase, you are listening to yourself. It is not like solving the problem, but you are getting an understanding about what's going on. That reflection gives you the objectivity to think about, okay, what I am going through. So in the reflection phase, it is like, I know where I am, I know what I am, and getting that self-awareness. That is reflection.
Self-awareness.
Yes. Yeah. Stage 5, it is like, now we tell about the summary, right? Like this is the summary phase where I integrate, okay, I have gone through this, I'm going through this is my day. And all that we are summarizing it and preparing ourselves for the coming adventures.
Yeah.
That is the integration phase it is.
Yeah. So like when we did, our muscle relaxation meditation, and you noticed you got a pain, or you noticed I have more tightness today than I did before. All that, observation you did, that self-awareness you did, how are you going to integrate that into your day and take that forward with you, right?
Yes.
Yeah.
That analyzing and, that part is coming the integration.
Yeah.
Yeah.
And taking it forward with you, right?
Yeah. Yeah.
Awesome.
Yes. Yeah. Okay.
What do we got next? Myths.
Yes, myths, the interesting one.
Myths, all the fun stuff, right? So
let's give some work for them.
Okay,
We're talking for a long time.
All right. Yeah, we talk too much, right?
Yeah.
So, we're group therapists, so we like it to
Talk,
interaction,
yeah.
right? So we're gonna go over the myths, and what I'm gonna do is I'm gonna give out a myth, and I want you guys to tell me in the chat if it is true or false. So again, I'm going to put that chat box up on my screen so that I can see what you guys are saying. So those of you who are getting that black box, you might on the screen, but that's okay because it shouldn't cover anything. So bear with me if you guys don't mind. And I love your guys's. I know we're like, we want to read what you're saying. Okay. I see what you're saying. She said, if you leave full screen mode.
Full screen, right?
Oh, I don't know how to do that. You're better. Let's see. Oh, just an idea. You know what? I think for this one, I don't need to do that, but for the rest of them, if I need to, Linda, I'm going to try that. So thank you so much for that feedback. Okay, so let's get into these myths about meditation. So the first one I'm going to throw out for you guys is you have to practice in complete silence. What do you guys think? Yes or no?
Oh, wow, wow, wow.
Whoa,
Oh,
whoa,
yeah,
whoa, 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 whoa.
yeah.
Perfect. No, 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 no. Myth, myth, myth,
That's
myth, myth.
false.
Awesome. Yeah. So you guys are absolutely right. So
Mhm.
that's the first myth that we have up here.
Mhm.
And it sounds like you guys all know about that one. Is that's an absolute myth, right? So yeah, you don't have to practice in silence. And that's probably one of the biggest myth that I challenge for my clients. And when we're in group therapy, they'll have that, right? They'll be like, it's too loud, or I hear something in the hallway, or I hear traffic noise outside. And I'm gonna say that's wonderful for us, right?
Yeah.
It gives us a chance to practice.
That's true.
Because we never have full silence in our lives. That's not possible, right? We're going to hear thoughts in our mind, and there's always going to be something going
will
on,
be there.
right?
Yeah, of course.
Yeah, so we don't need complete silence.
Yes.
And in fact, it's best training for our mind to be able to work through those things with mindfulness meditation, right? All right. Well, I guess actually, we'll move on to the next one. You have to empty your mind to meditate. What do you guys think? Okay, we got some no's, we got one yes, we got another yes. Yes, that's the goal, but you don't have to. Yes. Okay. So it's a little bit more of a mixed bag with this one. Sounds like some of you are like, no, but it would be nice, right? So I like that, Ariana, meet yourself where you're at, but it would be a goal. So that one's kind of conflicting, right? So maybe we're thinking it depends on the type of meditation.
That's true.
Okay.
Yeah.
Then that could be true, right?
Yeah.
So with mindfulness meditation in particular, this would be a myth, right? So just for mindfulness meditation, but you're right. Those of you that said yes, because there are different types of meditations where the goal would be to clear your mind, right, Chelsea?
Yeah, the ultimate goal is like, clear the mind like that. But it is again on the phases. Like preparation phase, we never can tell empty your mind, right?
It's a growth process. I like what Debbie
that's
said.
true. Yeah. It is a growth process. And when it becomes intense, we are very, into it, like then slowly. Yeah, gradually.
Yeah. So it's a mixed bag, right?
Yeah.
Yeah.
Yeah, we have the monkey minds,
Monkey
of
minds.
course.
Yeah. It takes a lot of practice. That's exactly true.
Only thing is that whenever the focus goes, focus back on your breath.
Yes.
Get it back.
Get it back. So I always tell clients that the goal is training, right? The goal is practice, actually. And so mindfulness is all about bringing it back to the breath, right? Bringing it back and not becoming attached to the thoughts, right? And so if it's totally okay if we do have thoughts, right? So, and again, we don't want to judge ourselves for having those thoughts. So, and we are still meditating even though we have those thoughts, and we didn't do poorly, and we didn't not meditate even if we have the thoughts, right? I like that one. As a rock climber, I think it is your worries that make you focus. Yeah, absolutely, right?
Yeah.
You have to be extremely focused of the dangers, right? Yeah,
danger.
absolutely. Which is probably why it is such a calming meditative practice for people who are rock climbers. So you're probably right on that. So that one's a yes and a no, right? Good one. Meditation requires hours of practice a day to master. What do you guys think? We got no, yes, no, no. Okay. So it looks like most people think no. Depends. Yeah. Yeah, it depends on the result you want, right? Like, what are you trying to achieve, right? So maybe if we're trying to achieve that emptying your mind type of thing, you might have to practice a whole lot to achieve that, maybe hours, right? Like you're saying. But most people would say that meditation doesn't require hours. It takes dedication and constant practice,
Yeah,
right?
practice.
More about
Time is not at all a
Mhm.
thing for it. Yeah.
yeah.
Whatever you are comfortable. 2 minutes, start with 2 minutes.
Mhm.
5 minutes, start with it. If you can sit for 1 hour, go for it.
Yeah.
That's it.
Yeah, so most
Mhm.
people would say it's more about the frequency at which you practice, right? So putting the time into actually integrating into your day rather than how long you stay in the meditation, right? Is
Yeah.
what is usually the case. But there are those that practice for hours a day, and no doubt they probably get closer to the emptying the mind than others, right? Yeah, but really good with that one. Okay, what's the next one? Meditation is always relaxing. What do you guys think about that one? That one's an interesting one. I like that. Ha, no. Yes, Paul. It can be a struggle. Should be. No. A little bit of a mixed bag on that one. That's the goal. Not always. Yeah. So a little bit of a mix there. Depends on the type of meditation. I think that's true. Yeah, I like you guys' answers. Yeah, so the thing is that meditation might not always be relaxing, especially with mindfulness meditation in particular. And that's because we are going to have the thoughts that we have. Remember, we're not judging those thoughts, and oftentimes our brain might naturally have more negative thoughts, right? The more aware we are of ourselves, particularly if you're not used to being aware of yourself and your feelings and your body sensations, it might actually be uncomfortable. And that's okay.
Yeah.
Right. And it's important that
Yeah.
we are okay with that.
That's true.
Yeah.
Yeah.
So might not always be relaxing, but
Yeah.
also worthwhile.
Yeah. It's about listening to inner self.
Mhm.
So yeah.
Yeah. And you might uncover some uncomfortable
Yeah.
truths during your
Mhm.
meditation.
Yes. Revelations.
Revelations
Awareness.
that you weren't
Yeah.
wanting to know,
Never. Yeah.
but came upon.
Or even when you think about, oh, morning, I didn't do that. Oh, I have to do it when I am back.
Yeah.
See,
Yeah.
remember?
So you might have come upon a new
Yeah,
anxiety.
that's true.
Yeah. So I think it's important that we're just conscious of that,
Yes.
it's not always relaxing, right?
Yep. Yep.
But it's about listening.
Mhm.
You must be still to meditate. What do you guys think about that? We
Mhm.
kind of addressed that a little
Yeah.
bit.
the ADHD.
Yeah.
Mhm.
With the ADHD, right?
Mhm.
Yeah. So the answer is false. Not necessarily. There are certain meditations where that is part of the practice. So you guys might, come upon those. With mindfulness meditation in particular, though, the answer is no. Like Kevin said, I enjoy walking meditation. So we talked about that type of
Yeah.
mindfulness meditation. And so the answer is no, you do not have to be still in order to practice meditation. There are types that you can do without it. And I think this is the last one. This one is a interesting one. Meditation is a religious practice. What do you guys think? True? No. Not necessarily. Can be spiritual. We're unsure. Maybe to some. It's spiritual. Depends on who you ask. Okay. So what we talked about is it's not religious necessarily, right? So
Yeah.
there are some origins of religion, right?
Yeah.
Like Jilzy had talked about.
Yes, yeah, as I said, no, it was connected or aligned with the religion only because the people will feel it obliged to practice it. Like, no, whatever religious practices, the people will think, okay, I have to do it. Otherwise, the God will be angry, like that, no? So, in order to make them do it, they connected with it. That's the only reason. It's not at all a religious practice. Anybody can do it. Anybody can do it. Yes.
Yeah, but as some of you are saying, there are religions that incorporate meditation into them. So it can be a religious practice, and it can make you feel more connected to your God and your religion.
The higher self, the higher power, like that.
Yeah. And so that's wonderful. And so I think that's a good thing to point out. And I think someone is pointing that out. If you have a client who is religious, that might be a way for them to connect to meditation.
Yes.
Someone had a client who refused to do it because of their origins. And maybe is providing some education on, yes, the origins were that way, but it has changed and evolved, and the current mindfulness meditation is extremely different than the original meditation that was done by the people that practiced it with religious practice, right? So the mindfulness meditation that we currently practice has nothing to do with that, right? It's very different. And so maybe just kind of talking to them about that and talking it through with them might help. We'll talk about that in barriers if you want to, but yeah, and these are different things. That's why we're talking about it with myths, right? So yes and no, right? On that one. Very good. Thank you guys
But
for
we don't want to
participating.
restrict it with any religion.
Yeah, we don't
That's
want to
it.
restrict
It's
it.
universal.
Universal. It can be universal. Yeah, absolutely.
Yeah.
All right. I'm going to take the chat off so it doesn't block anybody. We don't want to spend too much time on research again, because I know we're kind of running out of time here. I'm looking at the clock. I know we're gonna go to questions soon. Yeah, so oh man, we got quite a bit left. Okay, so Jilzy, if you want to touch on that.
Yeah, the researchers, right? Yeah. So there was some researches by Majumdar like that. And then it came to like, no, especially in psychological distress, well-being, quality of life, it is very important. Very beneficial to practice it like that. Yeah. And then along with the reduction of stress-related autonomic and endocrine measures after meditation, neuroimaging studies says that regulation of brain regions of affect regulation and attention control. We know that in exercise, meditation, everything, the endorphins will secrete. Serotonins, the sensitivity of the reuptake will be like that, increased like that. So it is like the physical benefits and mental benefits, both are in the meditation.
Wonderful.
Like that. Yes.
Yes.
So I think that's about right. The meaningful research is going on.
Yeah. And so when we get into incorporating meditation more into psychotherapy, we can see how it can help our clients with anxiety, attention issues, and things. And most of you guys are already aware of that and already utilizing it, right? Again, we're not going to spend too much time on this, but you guys will have our emails. And so if you have any questions, more particularly for Jilcy on this, you're certainly, can send those over to her. Come on, click. There it goes. All right. So incorporating mindfulness and meditation into therapy, we're going to review this a little bit. I assume most of you guys are already doing a little bit of this, but just in case, we're going to go over it for maybe any new clinicians. The first way that we're going to talk about incorporating mindfulness and meditation therapy is using mindfulness-based interventions. A lot of the interventions that are already evidence-based incorporate mindfulness already, right? So we don't have to find a way to incorporate them. We just use these interventions, right? So the first one that is on our list is DBT skills. Right. So most of us are trained in DBT and will use DBT skills. And at the very base of DBT is the use of mindfulness. Right. So that's a great way we can incorporate mindfulness into our practice with our clients. Another mindfulness-based intervention that does incorporate mindfulness, theirs is more through what they call awareness. So they use mindfulness less as a term, but more awareness, is this acceptance and commitment therapy. So that's a great way of incorporating that mindfulness. For those that work with clients that have chemical dependency issues, 12-step based concepts are a great way to use mindfulness. Talk a lot about being present, right? Being present in today, in the moment, in the minute, in the hour, right? And that's mindfulness, right? So there's a great connection between 12-step concepts and mindfulness concepts. We can give mindfulness activities as homework, and then we can process them in our sessions with our clients. So those are ways to integrate mindfulness into our programs, whether it's group therapy or an individual therapy. As far as incorporating meditation, some ways that we can do that is we can expose our clients to different types of meditations. Like I said, that's something we do here in our program. I'm a firm believer in that because, again, they can be resistant. So we play different guided meditations. We do all the different types so that they are exposed to different types. So we can incorporate them in. We can also encourage our clients to practice different meditations outside of sessions, and we can process their successes, their barriers, their progress in our sessions. So that's a way that we can incorporate meditation into psychotherapy. Another way is practicing breath work, which Jilcy said is a huge part of meditation. And also, we know that those are also coping mechanisms, right? So we can teach clients that not only is breath work coping mechanisms, but they're also meditation and a huge part of meditation. So we can practice breath work with our clients. So we can teach them breathing techniques and we can practice them with them as coping mechanisms. We can ask them to practice outside of sessions, and we can, again, talk to them about their progress. So those are some ways that we can incorporate into therapy. Jilzy's going to go over some of these additional types of meditation.
Yeah. So we talked about the Smriti meditation, right? That's one of the newest one adding to the psychotherapy, Ayurveda psychotherapy. So it is like a guided technique, to allow the client to understand, the reasons. Because we know that a lot of diseases are psychosomatic, especially the autoimmune disorders. So there is the psych part for it, for expressing the symptoms of the soma. So the client is allowed to understand what is the psych part of his somatic disease. So that's coming in the Smriti meditation, where the client is in a trance, where with a guided meditation, he is getting that awareness, what part I need to correct, which went wrong and expressed as autoimmune disease or any psychosomatic like that. That is the Smriti meditation. But we need a trained person to do it for sure.
Very trained person.
Yeah.
So this would not be something that one of us would incorporate into our practice. This would be someone who is specifically trained. We're letting you guys know about it so you're aware of it. And so if a client asks you about it, or says, I'd like to go get this type of meditation, that you're aware of how it's being incorporated.
Yeah, that's it. Yeah. And then we will come to pranayama. So in the beginning, we talked about yoga, pranayama, meditation, right? So during pranayama, it's again mindfulness it is. So controlling your breath while connecting with our mind and body. So if everybody is ready, we can do 2 types. There are 4 types. Since time crunch, we will do 2 types of it. The first one is anuloma viloma. That is the alternate nostril breathing. So for that, you can hold your hands like that. Can you see? The 2 fingers up, 2 down, 1 straight. The thumb is straight. So with that, we will close one nostril with these 2 fingers and the other with the thumb. So we are going to make an arch with the breathing. Breathing in through the right, breathing out through the left. Again, breathing in through the left, breathing out through the right. I'll show you first. So first I am breathing in through the right, closing the right nostril, breathing out through the left. Now breathing in through the left, closing it, breathing out through the right. So there's an arch, breathing in, breathing out. Okay, now we can start. Breathing in through the right and closing, breathing out through the left. You can close your eyes and do it. Breathing in through the left and breathe out through the right. Breathing in through the right and breathe out through the left. Okay. So we are making an arch with the breathing in, breathing out like that. This is called anuloma viloma. It is alternative nostril breathing. Breathing in, breathing out, breathing in like that it is. And the next one we are going to do is Brahmari. Female honeybee humming breath it is called. So in this, we will take a deep breath and we will breathe out, making a sound like a honeybee making. So the thing is that we are vibrating our vocal cords inside. When we vibrate it, we feel that vibration all throughout our body. I had a client who came in the morning and said, I feel more anxious today like that. Then I said, okay, sit. Let's do 2 breathing like that. I did the Brahmari and he felt the vibration all throughout the body. And after that, he said, okay, it was easy for me to focus when that sound and vibration was there. That one we can do it now.
Okay. Can
Okay.
you demonstrate?
Sure, I will demonstrate first.
All right.
Yeah. Okay, you can close your eyes and then breathe in. Like that it is. So
Is
initially,
there something different about the buzzing sound that you have to try to accomplish, Chelsea?
yeah, initially it will be a little hard. We try to constrict the throat a little bit.
Okay, constrict
So
your
that
throat.
the vocal cords will start to vibrate.
Okay.
Once it start to vibrate, even it can clear the throat, the respiratory, upper respiratory like that.
Okay.
We feel it vibrating. Yeah?
Okay.
One more time we can do it. Take a deep breath.
I can.
My practice.
I need to practice that.
Yeah.
That one's
Just
harder for me to do.
make some sound initially.
Yeah.
Later you will get it.
Yeah, I'll have to
doing
practice
it.
the sound on that one, but I could see the benefit.
Yeah, it is.
Yeah.
Yeah. That's called
Okay.
Brahmari. Okay, that too.
Very good.
Yes. Yeah.
Okay, wonderful.
Okay.
Okay.
Yes.
I'm going to go
Yeah.
over this really briefly because I know we're getting to our question time. So going over client resistance. So Josie and I know are both on the same page as this, that we want to be allies with our clients, right? So we want to bring meditation to our clients and meet them where they're at. And we want to remove as many barriers as humanly possible, right? So the first thing that we want to do to work through barriers with our clients is normalize them, right? So let them know that it's okay to be nervous, that most clients are nervous, most clients are reluctant to do meditation, and that's okay, right? And so just normalize that for them. And I find that makes them feel comfortable showing up to meditation however they show up, right? And let them know that I'm going to be okay with that, right? So that's important, I think. The next one is validating that for them, right? So validate their frustrations, their anxieties, their fears, and say, I understand that you're worried, especially for those trauma clients, like we said, if they're worried about the door, whatever it is, just validate them. And, again, normalize this as part of their process, as they have those barriers come up during their practice, right? So after every meditation, we process their meditation. So I encourage you guys to do that as you incorporate meditation with your clients. Do the meditation with them and then ask them how they did. Ask them how it went. Process it with them. And if they say, you know what, I feel like I did horrible today. I couldn't stop thinking about this. Say, that's okay, right? Validate it for them. That makes sense based on what your day was like. I see improvement in you. We're going to try again tomorrow. We'll try another meditation and just validate that as part of their process and keep encouraging them to keep trying. I encourage you to start small with your clients, go at their pace, see where they need to be, right? If you need to start with 1-2 minutes with them, you know, start small, start with smaller exercises, meet them where they're at.
Yeah.
And then again, try a variety, right? Some of them really respond well to guided meditation, some don't. Some respond very well to music, right?
Yes.
Some really like music, some really like the visualization, you know, and so just really try to find what's going to work for your client, and give them that variety and teach them that it's okay to find the one that works best for you, right? Find the right vibration.
That's
or
true. Yeah, which works. Yeah.
Yeah.
Customized.
Yeah, customize it to your
Yeah.
client, right? That's really, really important. Okay. And the last slide that we have is, as with any intervention that we use with clients, we always just want to be cautious. You know, are there any dark sides to meditation or any contraindications? So I'll let
that's
Josie
true.
take that.
Yeah, yeah. So main is the trauma. Sometimes, when they are silent and listening to themselves, the trauma will come up like that. That's a major challenge. Yeah. Again, as you said in the previous slide, if you customize it and meet where they are like that, it's easy to tackle down that.
Yeah.
Yeah.
And the only cases where, like it says that they can have a psychotic break or they
Yes.
can destabilize, I feel
Yeah.
like is when you're not being aware of those things,
Yes.
right?
Yeah, that's true.
Or if you're practicing outside of your scope, right?
Yeah,
And
that's
trying
true.
like a trance.
Trance or some intense ones.
Right.
Yeah.
Yeah. So be cautious of,
Yeah.
staying within your scope,
Yeah.
being cautious of meeting your clients where they're at. Don't
Yes.
try to
Yeah.
do a long meditation when
Yeah.
they're not stable.
Stable like that. Yeah. Yeah. So the dark side is mainly with the customizing and trying the different styles like that, according to which suit for them. That's it. Yeah.
Okay.
Yeah.
Yeah. And, it says, when I did my some additional research on it, it said that there are some people that have concerns with meditation, that it can increase dissociation, depersonalization for those that have that going on. But again, I think it depends on the type of meditation you're practicing, and you always want to be cautious with your clients, right? So if you have any of those concerns for your client, again, be cautious of the level of care that they're in, right? When you're practicing
true.
these types of meditations. If you're in the inpatient level of care and your clients aren't stable, stick with the simplest meditations that you possibly can in short periods of times. And I don't think that you would have to worry about these things, right?
That's true.
Yeah. So
Yeah.
those would be my concerns. Okay. All right. I won't go over the summary because, we've already gone over these things. Yeah, we need to get to Q&A time, I'm sure. Debbie, I think, are we at that time now?
We are. So we just had 2 questions in here. What books do you recommend for guided meditation in group settings?
Okay. So, to be honest, I'd actually have to go grab it. I purchased a book for our group settings, and found a good one and purchased it for my staff, and nobody has ever used it. I'm just being honest. My staff, we use online guided meditations mostly. So I did a verbal one for you guys today, but we mostly use other people's guided meditations, and we find that to be very successful. And I've done that for years and years. And I like that also because I think it really helps to use a variety of voices, to be honest.
And the everyday different topics they will be
doing. So what we mostly do, and not just here, but in my practice in other places, is YouTube is a really great resource for guided meditations. If you search, guided mindfulness meditations, you can tailor it by time frames, which is really nice. So you can search for 1 minute, 5 minute, 10 minute. I like to stay we do group therapy, and I like to stay in the 10 to 15 minute range. I find to be the sweet spot for my clients. How about you?
10 minutes.
10 minutes is a sweet spot. But YouTube is really great. You can find really great ones. Check them out ahead of time to make sure they don't have ads, but there's tons of them that don't. And listen to them ahead of time, but there's a lot of them that have really soothing voices because again, some clients respond better to female voices. Some clients respond better to male voices. Weirdly, this might sound weird to everyone. My favorite ones are by this guy that has this like soothing Australian accent. And again, I don't have a male Australian accent. So, if I'm doing
You
them
don't?
verbally from a book, I don't, Debbie. What's the matter with me? Right? So like, again, like tailoring to your clients and what you find that they respond well to. I like to, again, provide that variety. And once you find the ones that you find that your clients are responding the best to, you can save them in your library, and then use those more frequently as you get new clients in. So that's a good resource. I have a subscription that Jillsy uses and a lot of other my staff use to Calm, the Calm app. It is, a little expensive. I think it's like $70 a year. But if it's worth it to you, they have wonderful meditations on there. There's a lady that does a daily guided meditation, Tamara. And she does kind of a thing at the end where she encourages you to kind of think about a certain topic of the day. And so it can actually also give you a prompt to kind of process something with your clients too. So it kind of provides a segue into process time, which is kind of an added benefit. So yeah, we don't tend to use the books very much. So, but if you do want the book, email me and I'll get it to you.
Cool. And then one gal was saying humming comes naturally to her son who happens to be autistic, or have autism, which is nice. And then are there alternate types of breathing better for certain like situations or emotions?
Alternate breathing for
the Aniloma Viloma, right?
Yeah.
Aniloma Viloma goes good with the mindfulness meditation. So it is like, to ground, like it is the basic breathing technique, pranayama it is.
For like a wide range of emotions,
wide range,
right?
Yeah, wide range, like anybody can do it like that. So only thing is that while taking the breath and leaving it, we need to follow the breath. Like the air is going inside through the nostrils, filling the brain, like going, filling the lungs, giving the oxygen, taking the carbon dioxide. We get into the details and think about it, then it becomes a meditation.
Okay.
Yes, yeah. But anybody can do it. The simplest one. Yeah.
Awesome. Well, thank you, ladies, so much. I'm going to stop the recording.